Hi there, I'm Dan Payne from Schein, and this is Justin Hind from A-dec. We are here today to talk to you about the A-dec 500, the features and benefits for you and for your dentistry. So Justin, what do you think is the main feature of the A-dec 500?
Hi Dan, the A-dec 500 is our premium top-of-the-range chair, and there's actually many different reasons why a dentist would choose to purchase this chair. And what I'd like to do is run through each one individually just to build up a story of why a dentist would choose that. So Dan, I would like to first of all talk about our 500 stool.
Okay.
Now, the reason I want to talk about the 500 stool is, in my opinion, this is probably the most important bit of kit in the surgery for the dentist. Okay. This is what they sit on 7 to 8 hours a day, and a lot of people overlook it. So the 500 stool is actually built with ergonomics in mind for the dentist, and it's built to help the dentist be comfortable and work in a proper position with a nice S-shaped spine. So what I'd like you to do is, if you can sit in the stool, I'll show you exactly how we at A-dec would set it up.
Let's go.
Okay. So firstly, what we recommend is your knees should be lower than your hips. So you can adjust the height, and you can adjust the height up and down just to make sure that you're in that position. Does that feel comfortable for you?
That feels better.
Okay. Yeah. Your feet should be shoulder widths apart. Okay. Now, what we also like you to do is, if you tilt the seat forward, what that does is that releases the pressure off of your femoral artery.
Just like so.
That's it. Perfect. And what that will do is reduce any pins and needles to your feet. Okay. Now, to seat you in that nice upright S-shaped spine working position, I'd like you to adjust the backrest and adjust the height so it's comfortable for you. Okay, we normally say around the belt area.
Probably about there, I think.
Perfect. Yeah. Okay. Now, the lever on your left-hand side, if you pull that, that will actually lift the backrest closer into your back. And you can either have it so it's just a reminder, or you can have it so it's putting pressure in your back.
What's the benefits of either? So what's the benefits of the pressure? Okay,
depending on whether you're working in any back pain or not, what it'll do is, if it's putting pressure into the base of your back, it's going to hopefully help you to get that S-shaped spine.
Which is what I've got now.
Which is going to make you work in that upright position and hopefully lengthen your career.
Okay.
Okay?
Yeah, brilliant. Feels great.
So Dan, I would also like to talk about the thin backrest on the A-dec 500. The A-dec 500 is built around ergonomics for the dentist, and I would just like to show you this. So if you'd like to take a seat in the dentist stool, and position yourself at 11 or 12 o'clock position.
Just give us the delivery unit over here.
So working at that position, you'll be working with your patient with your shoulders nice and relaxed, and your hands as if you're reading a book or looking through your mobile phone. Okay. Now, the benefits of the thin backrest is, you're working at 12 o'clock at the moment. If you were, for example, working at 11 o'clock, then the patient is as low as possible.
Yeah.
Okay. And when the patient is as low as possible and you have a thin backrest, and you're then working on the patient in the patient's oral cavity, then your neck and shoulder muscles are more relaxed, because you're not taking into consideration the other height of the backrest. So if you have a thicker backrest, in theory, you're hunching your shoulders up a little bit like that, which is then going to put stress,
added pressure,
in your muscles, in your neck and your back.
Okay.
Now, what we also recommend is, if you are working and you want to work directly, you want to have a direct visual on the tooth structure. If you're working at 11 or 12 o'clock, what we don't want you to do is to start moving like this, moving at your core to try and get to that tooth structure.
Okay.
So ideally, if you move round to 9 o'clock, for example, perfect. Now, if you manipulate the patient's head and you move the patient's head slightly as well, from the 9 o'clock to the 12 o'clock position, you can then get a direct visual of the patient's tooth structure. What you've also benefit from as well is, you can get right underneath the back of the chair here. If it's a little bit low, you can raise the chair up a little bit, and you can literally get right underneath the patient again to get in that proper working position.
So Justin, we've spoken about the posture, etc. on the stools, but what about if somebody would prefer to be standing whilst in surgery rather than sitting?
Well, that's a very good question, Dan, actually, and very important with this setup. Now, a lot of dentists that I know do like to do standing up dentistry. If they're doing implants, they're doing surgical work. I know some dentists that just stand up all the time. So the benefits of this are you have the air brake on our delivery system. So when you're in that working position, if you've got a delivery system that's too low down, then you're going to have to start reaching down for your drills.
Sure.
If you've got a delivery system on an air brake such as this, then you can position it exactly where you want to, and you've got easy access to grab the drills, but still be working in an ergonomic position. The reason we've actually have the base cut out in the way it does, and also the upholstery cut out in this way, is just to give the dentist more access to the patient while being sure-footed.
Okay.
So we would move the armrest this way. I can get very close to the patient, and I've got the cutout here, so if I'm doing some kind of extraction,
Sure.
my feet are sure-footed, and I'm as close to the patient as I need to be. So we have a swivel function, and I'll show you the swivel function, but it can be used in many different ways and for many different reasons. It can be used if you're in a smaller surgery, you're doing a speciality, you wanted to bring a cart in. It can also be used if you wanted to get the patient closer to the x-ray. So pretty much we just move this lever here, and you can move the chair 30 degrees to the right and then 30 degrees to the left.
So that would help out if you had a shorter armed x-ray to be able to move the patient's head towards them.
Absolutely. Or if you're wheeling in a cart, you wanted to get the nurse in or someone else in as well, but if you had a speciality cart you wanted to get in, you can literally just tilt the chair in a different direction, and it gives you a little bit more space in the surgery.
And what about if the dentist is left-handed?
This can be set up left or right-handed, so it's a very simple process to do. So I would literally just move the delivery system up onto the chair. I'll move the cuspidor all the way around the chair, like so, and then bring the delivery system off here, and there you are, set up for a left-handed dentist.
That's really quick. That's great.
This is our LED light. There's been a lot of engineering going into this light. It's actually built to last for 20 years. Okay, very high quality LEDs, and LEDs are rated using the color rendering index out of 100, and they're rated at 94. What you've also got is the color temperature of the LEDs. Ours are rated at 5,000 degrees Kelvin, which is neutral white light. Now, the benefits of using neutral white light is if you're working on composites or you need to do shade taking, then the dentist can take the patient's shade while the patient's still in the chair using the LED light.
Wow, okay. Is there anything extra on the light that can help me whilst I'm taking composites?
Okay, well, in addition to the 3 different settings that we've got, you've got low, medium and high, and then you have the composite mode. So the composite mode uses yellow LEDs in the corners. They're rated at 25,000 lux, and what this does is it filters out all of the blue light. So it gives the dentist a longer working time when working with composites.
Brilliant, brilliant. Is there any other benefits and features from this light for the dentist?
The way that the LEDs are set up, we've got 8 LEDs around the centre here, and they are set up in a similar way to a football stadium, that they're sort of like they're pointing into the middle. And what that actually does is that helps to reduce shadowing. So you can position the light, and when the dentist and the nurse and hands and instruments are getting in the way, it will reduce the amount of shadowing that you've got. So if I run my hand over the light over here, you'll notice the light on the chair, it doesn't really change it too much. You're not getting any big shadowing, which is quite key.
So I get a lot of questions from dentists saying that they don't need an over-patient light anymore because they use loupes and they have enough light coming from their loupes. How do you feel about that?
Well, that is a very interesting question, and I do come across it quite a lot as well. Dentists who wear loupes, they should in theory be using the overhead light as well. Now, it's not just for eye fatigue for them, it's a benefit for the assistant, so the assistant can see what's happening.
Sure.
But the way they should have their lighting set up is in a 3-to-1 ratio from their loupes to the overhead light, and then you've got to think about the ambient lighting within the surgery as well. So if, for example, a dentist is working with their loupes at 90,000 lux, ideally you will have this light on at 30,000 lux, filling up the oral cavity with a ratio of 3-to-1.
Okay, so we can offset it with the settings on each light effectively.
Absolutely, absolutely. And what you'll also notice on this one, we have a magnesium backplate. So whereas the old halogens would get hot and they would heat up the surgery, this one stays very cool, even though you have it on all day.
And how about positioning of the light?
Okay, well, with our light, you can have it mounted in many different ways. You can have it ceiling mounted, you can have it chair mounted, wall mounted. It just depends on your surgery setup.
Sure.
But when you're actually positioning the light, the beauty of this light is you've got lots of rotations of access. So you can move the light from here, you can move the light around this way as well, and then you can also move the light. So whichever way you want it, you can get it into that perfect position to be working with your patient.
Fantastic. Justin, we've spoken about some amazing features for the dentist with the A-dec 500, but how does the patient benefit from your A-dec 500 chair?
Well, we've got the option of sewn upholstery on here at the moment, which is a very comfortable upholstery. The backrest is pressure mapped, and in addition to that, we have memory foam in the backrest and the headrest, so the patient is very comfortable. But also we have the wide backrest, so the patient's arms are actually being supported. So when they're in the supine position, they're feeling very comfortable and relaxed.
So that's ideal for a longer treatment procedure?
Oh, absolutely. A patient can be in the chair for 1, 2, 3, 4, 5 hours, depending on the procedure, and they're going to be feeling comfortable. Patient positioning is always a key point.
Yeah.
And making sure that, one, the patient is comfortable, but also the patient is in the right position for the dentist to perform whatever procedure they're going to do.
Okay.
So if you can take a seat, Dan.
Yeah.
Perfect. So one of the key areas is the headrest as well, and making sure that the patient's head is, one, in the right position, but two, so the patient is looking straight up so that the dentist has good access into the oral cavity. You'll also notice that Dan is nice and relaxed here, the backs of his arms are being supported, and he's feeling very comfortable. Okay, let's bring you back up.
Okay. So I noticed the movement on the way up is very smooth. Is there a reason for that?
Yeah, absolutely. The chair is fully hydraulic, and what we have is a soft start feature on the chair as well. So as the chair is moving, it releases the hydraulic fluid very slowly. So there's no jerking of the chair at all. So it just makes the experience a lot nicer. Also, if you've got nervous or elderly patients that don't like to go back too far, it just keeps it very smooth for them.
Brilliant. Thanks, Justin, for some great information with regard to the A-dec 500 and your brand. If anyone would like any further information on A-dec, please contact Henry Schein or A-dec. Thank you.